Hey guys, it's me, Stephanie. I just wanted to give you an update. It's probably been about a month and a half, maybe 2 months since my last update. Since you have seen me last, I have had my breast implants removed. I had a hard time healing from that. I ended up getting an infection in one and had to have another small surgery about a week and a half after, and was in the hospital on antibiotics for about 3 days. I'm fully recovered from that, and slowly but surely I have kind of started to feel better. A week ago, let me back up. I have been mostly bed-bound. Most days it's just really too painful to get out of bed. I'm weak, but last week I was unable to walk unassisted, and I had pain in my legs that I hadn't had as strong before. So I went to the emergency room as per my rheumatologist's office suggestion, and they ended up giving me a spinal tap, which was horrific and traumatic. It was bad. There was someone who hadn't done many, a PA, and she was excited to do it, so I don't think she's done many, and she just had a really hard time getting it in there. So I spent a lot of time in a lot of pain while she tried to figure it out, and then the doctor just took over after about 15 minutes and just rammed it in there. Ugh, I'm glad that's over. I'm also grateful that my spinal tap was clear. They didn't find any infections or anything that would cause a disease to make me unable to walk. So that took me about all of last week to get strength again in my legs. I'm walking unassisted now, and I feel pretty stable, which I'm grateful for. It's a really bad feeling to be stuck in bed while life is happening, outside your door. And so, recovering from that, and it was hard on me mentally. But the thing that gets me through is, each night I go to bed and I hope, maybe tomorrow will be a good day. And that's what I have to have, is hope. So, I'm trying to think of what the next steps are. I have to have an MRI done on my lower abdomen, because when I went to my doctor's appointment for the checkup after discharge from the emergency room, he wants to look, actually it's on my spine. He wants to look at my spine to make sure that there's not an issue with my nerves in my spine that is, making me unable to walk at times. The weird thing is, I don't know what triggers it, and I definitely don't know what's causing it. I have gotten some test results back from my rheumatologist's initial appointment. My ANA, which looks for autoimmune diseases like lupus, came back, I don't know if it's negative or clear. Don't have that. My rheumatoid factor also negative. There were some kind of weird results that I have had come up, my C-reactive protein is always high. There are markers in my CBC and my comprehensive metabolic panel that that indicate inflammation. I was tested for multiple myeloma, and there was something in my blood results, but I didn't have the IgM, and I guess the M is what determines if you have cancer or not, so I'm grateful for that. I have high lipase, which I have often, which is something that indicates pancreatitis, and that I don't seem to feel any symptoms of, that I am aware of. Though I have so many things going on, it's hard to know like what is causing what. I still have chronic nausea like every day. I have to take Zofran 8 milligrams twice a day, and I also take Dramamine, which kind of helps with the nausea that the Zofran doesn't completely get rid of, and I take that twice a day. The Sexenda I am still taking. I'm months into it now. I have lost like 5 pounds, 7 pounds, something like that. But I am also inactive. So that's what I'm hoping is keeping the weight down. And I also know that inflammation can also make it hard to lose weight. I'm not really too focused on that right now. I am getting a sleep study done tonight. This will be my 3rd sleep study, and they are not the most comfortable thing. Like, knowing people are watching me sleep, like, doesn't make me feel like sleeping. It's kind of one of, like, my fears. Like, waking up and seeing someone stare at me, like, freaks me out. And when they look at you during the sleep study, the room's dark, but there's a red light on the camera that turns on. So, like, your room turns into, like, a red room while they are looking at you, which is odd. So anyways, that's tonight. I'm trying to cover all my bases on things that I can do to help me get well. I know that I had sleep apnea before my gastric bypass, and I have not been tested since. I have not been using my CPAP because I just don't tolerate things on my face when I'm sleeping, and so I end up taking it off in my sleep. And I also sleep on my side, which is painful because of the mask. I think that's about it. I have to get the ultrasound that I'm getting on Monday is of my abdomen. When my doctor was pushing on my stomach, he found a really tender spot that neither of us were expecting, and that was in the area of where my appendix lived. And I say that past tense. My appendix was removed in 99, I think, but he said that sometimes the stump can get inflamed or infected. He even said that people's appendix can grow back, which I didn't know, and that's interesting, but that's another subject. Yeah. So my goals going forward are, I need to get back on the AIP diet and be completely compliant with that. I have completely gone off of that, and I don't think that's good for me right now. Like, most times I eat, like, recently, make me bloat up, and I get the worst gas pains, and I need to just stick to protein and veggies and some fruits. that's about it. I am now trying to get some exercise in as I can now that I can walk, and I'm not really worried about fall risk. So, I mean, exercising and eating right and getting the things taken care of that I can do as far as my health is what I'm doing going forward. I think there's still a long journey left for me. It seems like if something will go wrong, it has. But I'm hoping going forward that won't be the case, and I'll start getting some answers. Going to the rheumatologist in a couple weeks. She's going to go over all the lab results with me and tell me what she thinks from those. And yeah, I'm in good spirits, and that is what I'm most grateful for. I'm not sure how I do it, to be honest, but my girls keep me going, and just I'm tired of being sick. And so I think that only a positive attitude can help me feel better when my body is not. So I hope you are all well. Thank you, as always, for your support. If you're new to my channel, thanks for stopping by. Please don't forget to subscribe if you want to follow my journey. Yeah, I will try and update more often, and I really look forward to interacting with all of you in the comments. They always mean so much. So thank you, and I hope you are all well. Bye.